Welcome, everybody, to Neck and Shoulder Pain, What to Know, How to Get Relief. In this 45-minute webinar, learn ways to reduce, relieve, and say goodbye to your neck and shoulder pain. The information will be practical and we hope helpful to you or a loved one. There will be an opportunity for live questions and answers with the doctors at the end of the webinar. And with that, let's get started. Over to you, doctors.
So, it's a pleasure for us to be here and share the information that we've accumulated over the years and that we see in practice to help everyone have a better understanding of their neck, their shoulder problems, arm pain. Because I'm going to think that in this office, and Mark, you can attest to this, that second to lower back pain that comes into this office, I'm going to think neck and shoulder are probably the second most common complaint.
Oh, absolutely. Very common.
Right? And when we get those complaints, our process to figure out, again, what makes us different is not just address the pain, but find what?
Where the problem's coming from, ultimately.
Yeah. And we have a process of doing that.
Right. So any patient who comes to our office, everybody wants a quick adjustment, but what's causing it? And that's what we have to do, a thorough consultation, 36 orthopedic tests. We like to do a thermal scan of your spine, your nervous system, your muscles to tell us exactly where the nerve is irritated, the muscles are tight. And then after that, we need to take digital films, most importantly of the patient standing up. It's critical, and especially when we're looking at neck and shoulder, we do specific views.
Right. Now, people don't understand a thermal scan, what that means.
Right.
We use it as part of our everyday language, but it tells us exactly where the irritation is or the problem is, because as we're doctors of finding the cause. So how does that help us?
Yeah, when you know where the cause is, you're ultimately going to find a solution, because unfortunately, sometimes patients wait for months and even years before they decide to go to a chiropractor to find a solution.
Right. And I got to, sometimes we laugh about it, but, people have the most common responses. Well, I thought it would go away on its own.
Right.
Or how long have you had the problem? Well, it's kind of been on and off for years, but only the last 2 weeks that this really got bad. And neck problems can also create shoulder problems. Like I had a woman in the other day, and she goes, my shoulder's really giving me trouble. I go, well, show me where it hurts. And she grabs right up in here between the neck and the shoulder.
Right.
And I said, well, was there an injury to the shoulder? No. Did you fall? No. It really wasn't the shoulder. It was the trapezius muscle, which is the result, which will show you how the nerves from the neck can affect that part of the body.
Absolutely. And other conditions that forward head posture can cause is stenosis on the vertebral artery, which can cause balance issues and ultimately affect somebody's ability to stand and ambulate. So it's important.
Right. What about headaches?
Common. And
Right.
then even breathing issues. If your head's forward, it disperses so much pressure on some of the nerves that are communicating to your lung and your diaphragm.
Right. So it's funny because patients are surprised, when we're working on them for neck and shoulder issues, and we'll ask them after maybe a couple weeks of care, and they go, "What?" I say, "What have you noticed since we've been working on you?" They said, "It's funny, my headaches are gone,"
Right.
and they didn't even complain about headaches. Sometimes we'll ask them in a consultation, "Do you get headaches?" The patient will say, "Well, just the usual headaches." I said, no. There are no usual headaches.
Right.
And in our studies and on our education, we know that there's 147 classifications of headaches. And the number one and most common is called cervicogenic, which means originating at the cervical spine. So the neck is the cervical spine.
Mm-hmm.
Right?
Right.
Causes.
Let's dive into that.
Yeah.
So what causes shoulder and neck pain is one, posture. Posture is ultimately one of the 10 longevities of your health, and it's most commonly never looked at anywhere else.
Right.
And why is that?
Well, how many doctors will go in and say, we're going to take your blood pressure, we're going to do some blood work, I'm going to do an EKG, do they ever say we want to look at your posture?
Never heard it. It's
No.
usually like when I'm working with the patient for the very first time during the consultation or the examination, they're blown away that we're actually looking at their posture and how it relates to their health, their balance, their movement, their longevity. And without posture, you're just adding fuel to the fire, which will cause that neck and shoulder discomfort.
Right. So I just put up on the screen, and maybe you'll get a clip of it later. But it shows posture, and with forward head posture, which is what we're seeing, especially since the pandemic, since we're working on laptops on our dining room table, we're bent forward, and that forward head posture affects the nerves in the lower neck, which go into the shoulder. And I just want to reference, we did a video, if you go to our website, how to stay fit while you sit. And if you go onto the website under the blog, under videos, you'll see a program we did on good ergonomics and exercises to do when you're sitting at the laptop.
Yeah. And one of the things that Steve had mentioned, Dr. Levine, he mentioned that forward head posture. So how heavy is the head? It's 10 to 14 pounds normally. And studies show that any inch past normal range of motion or normal absolute great posture, it puts another 10 pounds on. So imagine if somebody's like this or this, you're talking 40, 50 pounds of pressure on your nerves, which supply your organs, such as your heart and your lungs, but ultimately your arms. So classically, we hear a lot of our patients coming in to us that have carpal tunnel syndrome. We're familiar with that, right?
Yeah, we hear it all the time. Even patients that have had carpal tunnel surgery.
Yeah.
They said, we'll ask them in a consultation, are you still having symptoms? They say yes.
Yeah.
Why? Because the carpal tunnel was not the actual cause. It was a neck issue.
Right.
But, going back to your posture, we're the only doctors that do a posture evaluation.
Mm-hmm.
And if there's a point in the patient's care where we'll take our iPad and we'll take a picture of them in forward, looking at them from the front and from the side.
Right.
And then we prescribe specific exercises to help correct the posture. So as a goal, our first step is to get a patient out of pain and feel better. That happens in the short term. I'm going to say 99% of the time.
Right.
Then the next step is to work on stabilization and structure. And that's where the posture analysis comes in, because we change the exercises to help correct the posture, because being upright and being in extension with the spine is better than being compressed and in flexion, like we are in front of our computers and our cell phones all day long.
Right. And just to show the average person is this is a model of the spine, and ultimately we should have these curves, which are called curvatures, lordosis of the neck. But when you're constantly in forward flexion, looking at your screen at work or driving to work, eating your breakfast, focusing on a book, or more commonly, the telephone. We're not looking at our telephones like this. We're looking at them like this. This is abnormal. Do you know what this is causing?
Tell me.
It's called subluxation, which is a bone out of place, putting pressure on a nerve. And that's ultimately going to lead to excessive and early degeneration of the spine. And our job as chiropractors is to find where it is, how long it's been there, and make sure that we can correct it before it becomes chronic and permanent. And the last thing a patient likes hearing in our office is, sorry, we can't help you. This problem is permanent. And that's what we have to determine.
And it's sad, because there are times where we do a thorough consultation, orthopedic, neurological, chiropractic, postural evaluation. We do the thermal scan. We look at the digital films. And when we do our report of findings, it's like, we don't know that we can help you with your problem. We do a trial of care for a few weeks. And if we're not getting the results that we have expectations, we have to release the patient. Right. But interesting, you brought up in our evaluation, we do a digital film. And when we do our films of the neck, not only do we want to see, as Dr. Mark said, a standing x-ray to see the neutral curve of the neck, right, which we see here, okay? but we also do what's called the flexion extension study. So we'll have you bend your head forward, and then we have you come into extension. So we get to see the motion of the spine. And to give you an example, what we anticipate seeing is I want to see the neck move where each vertebra moves independently. What we tend to see is that the neck is locked and just moves from one position. So picture your head, you're looking at your cell phone, and it just goes down. Just like this, all the vertebrae don't move, just one segment becomes hypermobile, and the rest start to become degenerative, right?
Absolutely. So how do we start to fix these problems?
Well, when you've talked about causes, I just want to touch on that a lot of it's lifestyle, how we eat, how we move, how we think, but our computers, our devices, but sleep is a big issue, is it not, as far as causing it?
Yeah, most people don't realize that sleep can be detrimental to their spine, their nervous system, and also their body's ability to heal.
So what's one question that we ask in a consultation is what?
Well, how do you sleep? Number one, on your back, side, or stomach. And we're surprised how many people say stomach to us.
Stomach.
And it's one of the worst things you can actually do.
Really? Why is that?
Well, there's a couple of reasons. One is it puts added stress on your nervous system. It's putting those curves that should be naturally supported on your back or your side in a predisposed pressure. So it's going to irritate the nerves. It's going to cause accentuated curvature, and ultimately it can lead to permanent damage. Some of the common side effects of sleeping on your stomach is numbness and tingling in your arm, weakened abdominal core. Those are just a few.
So if I'm sleeping face down, I'm on my stomach, I can't sleep my face in the pillow.
No,
I have to turn my head one way
one way
or the other way,
and
I might wake up with a stiff neck.
you're more than likely going to wake up with a stiff neck.
What's the preferred posture?
On your back or your side.
Right.
On your back or your side.
So if we talk about solutions for sleeping, one of the other questions we ask is how many pillows do you sleep with under your head? And we specify under your head. Some people have 5 pillows around them, but why is the doctor asking how many pillows? And we're the only ones that ask that.
Yeah.
How many pillows under your head?
It comes back down to posture. If your neck should be supported, if you have 3, 4, 5 pillows underneath your neck, underneath your arms, it's going to ultimately put stress on the curvature,
right?
The spinal muscles that are supporting each bone, and ultimately the nerves. And the nerves cause
subluxation, nerve inflammation, and pain.
And just to talk about it, if a patient's saying to me, "Hey, I got this pain in my shoulder and my neck," and they're pointing right here, well, this is a muscle. What controls the muscle is
the nerve.
The nerve.
Right. And muscles do 2 things. They contract and relax. So when someone says, "Doc, I don't know that you can help me. I think it's just a muscular problem." Really? Well, if the muscle is controlled by the nerve and the muscle length is controlled by the position of the vertebra, it's really a neuromuscular skeletal problem. You can't separate the 3 because we've got tendons, we've got ligaments, we've got muscles, we've got nerve, we've got bone. They're all intimately working together. It's not one or the other. So, when a patient tells us that, well, my Aunt Bessie told me that I should use heat, okay, because this is probably one of the most common questions we get. Should I use ice or heat, Dr. Mark?
When we're dealing with the nervous system, it's inflammation. You want to add ice, and we're so adamant about that, and it really does work better than your Tylenol, better than your Advil, because it's over the problem. And we advise the patient, depending on where the problem is, to put it over the neck for 20 minutes, take it off for 20 minutes, and then put it back on for 20 minutes. And it's instant relief. And there's no guessing.
Right.
We're pinpoint accurate.
Right. And we've got a lot of better healthy nutritional solutions to help inflammation and joint pain, where Advil, Tylenol, Uraleve, it's all damaging to the gut, damaging to the liver, the kidney. There are better supplements that are healthy without side effects. Right. And that's That's critical. Another cause, and I know we're bouncing around a little bit, is the people that are working on getting healthy
Yes.
and going to the gym, and they say, I work out 4, 5, 6 days a week, and I don't know what I'm doing, but I can't move my head.
Right.
Or I'm having problem lifting my shoulder.
Mhm.
What's going on at the gym?
So a couple things is it comes down to your posture, and you have to assess your lifestyle, your age, where you're at, and what you really want to achieve. I don't know if it's appropriate if a 50 to 60-year-old is there bench pressing or shoulder pressing 200 pounds over their head, deadlifts, and then they're coming into me the next day and they're saying, oh my God, my neck and shoulder is burning and I have a numbness going down my arm. Ultimately, you might be part of the problem. So you have to do a few things to be smart. You have to lighten up the load, focus more on your posture. And if you lighten up your load, you can do more reps, controlled reps, which are ultimately safer and just as effective as lifting heavy weights. And there's the science and the studies are behind it.
Right. So we talked about various causes, all right? You know, lifestyle, sitting in front of the computer, on their cell phone, sleep posture over many years, which is wrong.
Mm-hmm.
You know, I always say you have a money back guarantee for pain for the first 25 years of your life. All of a sudden, the warranty runs out and things start breaking down. And people are doing the same things that they've always done. And they're in their 40s, 50s, or 60s. And I've been doing this since my 20s. Well, maybe the body's just breaking down from wear and tear.
Right, changing.
Right?
Yeah.
So how about some solutions? How do we fix this?
Well, one is, like we had mentioned, sleep is a huge tribute to your health, and that's the time your body needs to rest. So how do you support it at night with 3 pillows, 4 pillows, or just how about 1 pillow?
Right. I brought in this cervical pillow, and the key for cervical pillows, and if you get our emails newsletter this week, our email newsletter talks about having a curved pillow to support the neck. If you're on your back, you want the head is heavier than the neck, so you want to support the neck. If you're on your side, you want to support the shoulder. So there are many different curved pillows out there. You got to find the one that fits you best, but we picked the one most common that you know, people are out there spending $200 for a fancy pillow. These are inexpensive and effective. So we did the research.
Right, and it takes time to make a positive change. So even with the neck pillow, some patients will say to us, well, you know what, the first night was uncomfortable. Well, that's going to be the case because you've been sleeping on the wrong thing for, you know, 20, 30 years of your life. So you have to start somewhere, and that somewhere is with a good neck pillow. Yeah.
Another solution is exercise.
Right.
Right, and the appropriate exercise. So how do we handle that?
Well, exercise, as I mentioned before, it should be lighter. It should be more emphasized on posture, technique, and these are things we go over with our patients ongoing. And there are very specific exercises we do give to each one of our patients that are unique to their condition because everyone's spine is different.
All right, so we look at an X-ray, and based on the structure of your spine, we want to put it in the correct position, but we need your help to do that. And so it's not appropriate just to go on the internet and say, what are the exercises for neck pain? There are some general ones which aren't bad, but wouldn't you want it custom for you?
Right.
You know, so we'll look at a film multiple times and come up with the right stretches or exercises. One of the most common things is because there's forward head posture, we lose the curve in the neck. And one of the ways to bring it back, and you've got that cervical orthosis behind you, we'll do this in the office with patients. And if they're comfortable with it, we'll recommend that they do it at home at night, 5 to 10 minutes before bed, which is an exercise. And it's a way to increase the curve and reduce the muscle tension, open the disc, increase circulation, take the pressure off the nerve.
Perfect.
Right? Great little tool.
Yeah, it doesn't look like much, but when our patients get off the table and they feel relieved and there's less tension in their neck, their shoulder, and upper back, they're wild. They're like, where do I get this? And
so we brought them in. We brought them in so we can do it. Another key is I said, go on our website to see Stay Fit While You Sit, because too many times, whether it be a sitting desk or a standing desk, we tend to lean forward. So we always recommend putting something under your feet, whether you're sitting or standing. If standing, you alternate your feet. I've told many patients, I said, get 4 reams of paper, put them down 2 by 2, and alternate putting your foot on it. It changes your posture.
Right.
You still need to be upright. But another tool that's helped a lot of people, and I'll let you talk about it since
Well,
I got you a little bit larger one, so you don't have to strain putting it on.
excellent. Yeah, how large I am over here. So this is called a posture medic. So there's so many devices out there that can be worn all day. But what's unique about this particular equipment that we advise our patients on is it's an actual exercise tool. So instead of you just adding a device on that's going to bring you from here to here and hold you all day, what happens when you take that tool device off? You just go back to the old posture. So with this, it's an actual exercising device that inside each, package is a exercise chart, which takes you from stretching to stabilization to strengthening the muscles, because there's ultimately muscles that are overcompensating, that are tight in the front of your spine, and the muscles in the back are weakened and over lengthened. And this actually takes you to the place where you're going to do the job that's going to hold it for not just when you take it off, but for the rest of your life. And if patients do want to get that instant relief, it actually serves as a posture medic. So it's going to go over here. And what it does is it simply, instead of the shoulders being rounded forward, once the patient puts it on, they're going to notice quickly, because it's rubber and it's elastic and it has recoil, they're going to stand up taller and they're going to feel more supported.
And it pulls your head back and your upper back, because the upper back muscles get stretched out and you're bent forward all day long. This instrument not only exercises those muscles to bring your shoulders back, but it reinforces your shoulders be back when you're working on your laptop, your computer, because we want to keep your chin parallel to the floor and not down like this in the neutral position. Right. So just as an overview, we talked about how the nerves in the neck can affect down the arm, numbness in the hand, elbow pain, shoulder pain can all be nerve related. Our evaluation will go into where the cause of the problem is. We identified solutions.
And then I think it's important is like, why don't people come sooner to a chiropractor?
It's interesting you said that.
It doesn't make any sense to me. If somebody's been living with the problem for, we see patients, they'll say 30 years. I have a 35-year-old gentleman that could barely stand because of his neck and his upper back pain. And I said, why did you wait 15 years? Well, one, he sent his wife who was pregnant and had a great response. But why does he wait that long?
Well, I think as patients come to us, sometimes it's a last resort.
True.
And, we review every case, the 3 doctors that are in the office right now. And we're like, well, I wish the patient was here 10 years ago or 15 years ago. And if we dig down deeper and find out why, it's like, well, I was really afraid of the twisting or turning or popping of my neck. And we hear that all the time, even though I've been doing this 38 years, you're almost 20 years, and we've never had an incident. But the beautiful part about, we have options in this office about treatment plans. And one of the ways is we use this computerized instrument, and the Pro Adjuster, actually, there's no twisting, turning, or popping. We measure the actual vertebra movement with a graph. And then if the graph is off balance, the device comes in and taps the vertebra, and the instrument shuts off automatically. And that's nice, because when the soft tissue changes, the vertebra moves, the instrument stops. So you don't get too much or too little, you get just what you need. And for those people that are concerned, that concern stops. Because one of the questions we ask in a consultation, have you ever been to a chiropractor? And the patient says, no. I said, do you have any concerns? And they said, well, I'm a little nervous about this. I said, we don't have to do that. We have an instrument, it's computerized. it's systemized, it's safe, it's comfortable, it's consistent. So get the relief you need.
Right, absolutely.
And I don't know, I think we can go to questions. What do you think?
Sounds good to me. Sounds
Great. Okay, thank you, doctors. Folks, keep those questions coming in, and we'll start with the ones that we have so far. So first question here, and we'll hand it over to both of you. So you decide who answers first, but we want to hear from both of you. Question is, if I develop neck pain, is there automatically a risk that the pain will migrate into my shoulder?
Ultimately, if you develop neck pain, the muscles are going to start to contract. And once they've been compensating for months or weeks, ultimately that pain can start to travel into the shoulder because it's changing the biomechanics of the body. So yes, absolutely.
Yeah, and I think the longer you wait to deal with a problem, the pain progresses and symptoms get worse. I think the biggest concern is that patient said, I had this before, but it went away. Well, let me ask you a question. If you're driving your car and your check engine light comes on, you have concern. But if it goes away, you're going to be asking, well, maybe I have more concern because why did it go on and go off and then come on again? And you're driving, you might be more concerned about your car than your body, which is a big mistake.
Absolutely.
That's a good segue into the next question. So you guys talk about wishing that a patient came in and would have seen you 15, 20 years ago. How does someone know that perhaps they just slept wrong, their neck hurts, they're going to be okay in a couple of days versus coming to see you at the right time? If they start to feel pain for the first time in their life, is it, should they come and see you after 5 days of continuous pain, or what would be your advice on the other side of that spectrum?
I would think that based on the degree of pain that you've had, and if you've never had it before and you don't really know why this is happening, you might want to get answers. Some people choose just to take something over the counter, which is not solving a problem, it's just taking care of the symptom. And I'm going to tell you, physiologically, the nerve which is causing the pain, only 10% of that nerve deals with the symptom that you're feeling. You can have pressure on 90% of that nerve and feel no pain. Now, that nerve could also be going to your heart and your lungs, could be going to your thyroid, could be going to different organs of the body. I think it's most important if there's a nerve pain, that's a problem. Even if the pain goes away, what caused it?
Yeah, absolutely. And, the body is telling you subtle clues. If you sleep and you wake up with a pain, well, you know what? It's probably because there's a problem there. And ultimately, if you don't look deeper into it, it's going to create more and more irritation. Like, for instance, if somebody has a toothache, all right, and all of a sudden, that doesn't feel right. And if they don't get it checked up, ultimately it's going to become a cavity to a root canal. So it's the body's subtle clues to tell you, hey, take a better look. And the better look might be first with your chiropractor.
Great. We have a question on your assessment. You guys talked in the beginning about 36 tests throughout the assessment. Can you talk a little bit about what it's like to come into an assessment at your center and what to expect and how long that would take?
That could be a separate webinar.
Yeah, absolutely.
Go ahead.
Yeah, so if a patient comes into our office, the initial visit's going to be about 45 minutes long with a consultation, examination, thermal technology, digital x-rays, and then a release procedure. So it takes about 45 minutes. And during our exam, we are addressing your posture from the front, from the side. We're checking your mobility, ranges of motion of your neck, your low back, your hips, your thighs, your arms, your legs. We're diving deep into your neurological sensory changes. So we're checking all systems of the body for reflexes and sensitivity changes. And then we're also going through multiple orthopedic tests to determine where the problem is and how long it's been there. So when a patient comes in, they're kind of blown away because it's so intensive on finding the problem and ultimately leading us to a solution and getting them back to their normal lifestyle.
I think he said it all.
Great. We've got one last question here, and it is about some of the the like the neck pillow and that the posture band that you showed. Can folks come and buy that directly from your organization, or do they need to go through the assessment first to see which of any they would need?
No, if someone wants one of these products, they can just come in and pick it up. We have patients coming in, or people coming in that aren't patients picking up nutritional supplements and neck pillows because a friend of theirs has it and they want to try that first, and that's fine. They trust us for the products that we pick because we test everything personally.
I agree.
Great. Before we sign off, any last words or any last pieces of advice, doctors?
I'm going to say it's better to come from a place of knowing, because knowledge is power. We give you information about your body and how your body works, and we'll make recommendations, but ultimately it's a free country and medical freedom is important. You get to choose how you want to take care of you, and we'll give you all the tools and information you need to make those decisions. But you make the choice about your healthcare, not me.
Perfect.
Great. Thank you so much. And with that, we're going to wrap up the webinar. Thank you, everyone, for joining us today. And if you'd like to book an assessment, simply call into the office at 973-761-0022. Thank you so much and have a great day.
Thank you.
Thank you.